Good morning. So, this will be the real first episode of content, yesterday being the intro, and I hope you're going to enjoy it. The theme for at least the next month is going to revolve around a question that I was recently asked on several podcasts. I was interviewed by Mark Costas and by the All-Star Academy, and I had been discussing this a lot with my friend Cal Fussman, who also has a podcast. And Cal's interested in changing healthcare. As am I. I want to help those who help others in a more effective, efficient, and happy way, and that's you. So the question was, what did I realize more acutely during the pandemic about the profession? What were the glaring revelations? What were the glaring mistakes? And how can we fix them? And that's what led me to decide to discuss this singular issue over the next however many sessions it takes, because sort of like a fireside chat. I get up in the morning and I sit down with you and discuss a topic. So the topic we're going to be discussing is what I believe to be the single most important skill that a dentist has in getting what they know up here and what they do over here out to other people. And that's communication. Communication is by far and away looking back at 45 years in the profession, communication was by far and away the single biggest component and factor in my success. And I believe that one of the things that I found during the pandemic was that those who communicated well not only withstood some of the ill effects of the pandemic, but they got back quicker. Their rebound was much faster than those who did not communicate. And what was interesting is that those who communicated well before the pandemic did even better than the ones who started communicating during the pandemic. So if you had been communicating before the pandemic, kudos to you. And I'm sure that you found that your rebound was pretty quick, because that's the power of communication. That's the power of people being used to hearing from you. When they don't, and I've experienced this firsthand, and I'll explain. When they don't communicate, they don't hear from you, when they're used to hearing from you and you stop, they're going to reach out. If your communications, and we'll talk about this too, if your communications are of a nature that they're not just informational, they're not just educational, but they're also they impart part of your personality or your practice's brand, then they're really going to miss it when it's taken away. So we're going to talk about communication. We're going to talk about personality. We'll talk about education. We'll talk about how you can utilize communication in a way that will get you more patients of the type that you want, allow you to get them to accept your best treatment or the kinds of treatment you prefer doing, will increase your case acceptance considerably, will encourage your patients to come back and comply with whatever maintenance schedule you think is appropriate for them, and will do something that is probably the single biggest problem in most of the offices that I see, and that is churn. And I'll explain. Churn is the turnover. It's what happens when patients come into your practice and leave. And that costs you way more than not having enough new patients. And we'll explain that too. Lots to talk about. Many, many, many topics. We'll try to do it as systematically as possible. But that's part of the fun of doing this, is that I just free roam. There's no script. I get up. I know I have a topic to talk about with you, unless something comes up overnight. And we'll talk about how that impacts you, because that's what's important to me, helping you. Have a great one.